Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and we have Lisa back here with us this afternoon, and this is number 4 out of your 8 treatments, so we're about halfway through. And Chris, her husband, this afternoon, he's going to be doing her hiatal hernia on her stomach where he's pulling it down, so we want to make sure that the spouse or significant other that comes with the person with the hiatal hernia knows how to pull that down and what it feels like by the time they leave here. So let's check you out and see what you're looking like this afternoon there, Lisa. Okay, let's have you flex your hip forward and backwards. Range of motion's excellent. Still a little bit translated, but not bad. Your pelvis is more centered up right now than it has been. That's a good thing. Your mid-thoracic spine's translated just a little bit to the right. See how you have less room here than you do over here? And that's right there in the area that supplies the nerves and the muscles to the celiac plexus, or your stomach and diaphragm. So we're going to actually put a TENS unit on her, trans-electrical nerve stimulation unit, on her mid and lower thoracic region, so that we can help her to stimulate the somatovisceral reflex when she's at home. And we'll show you how to put that on today as well. And you can do that too for her at home. That'll help. The only contraindications to using that is if you have a pacemaker, and you don't have a pacemaker, so just don't take it to Christmas and shock Grandpa. Okay, so let's do this first. Let's go ahead and decompress you first. I'm going to do this real light and smooth this afternoon. Okay. There you go. Okay. Lisa, she's in the very last pegs here, so she's in the thin category, like Renee. Renee's one of the few people we get all the pegs into. There we go. Yep, good. Okay, get your hair out of the way. There we go. Good. Okay. Yeah, take a nice deep breath through your nose. Let it all out and relax. There you go. Oh yeah, good. You feel that all the way down?
Oh yeah.
Okay, good.
Keep breathing.
Yeah.
It's just that initial shock.
Yeah, it's a, everybody reacts differently.
But for people who don't know, I got that scoliosis up at the front, so that's where it hit.
Yeah, she feels this a lot right in that mid-thoracic region, where the nerves supply the stomach and the celiac plexus and the diaphragm. Scoliosis is a lateral curvature of the spine. The spine's supposed to be straight from the front to back view, so if you see a lateral curve or a snake-like look to the spine, that's the scoliosis. Okay, let's come over here on your tummy. And we'll go right down in there. Now, her leg had been short on the left by about 1/2 inch, but that is exactly even right now, so that's a good start. It stays even. Does that hurt in your lower back today?
Yes, sir.
Okay, good. So you get some improvement there. Now, her sacrum down here was really sore when we first started. And it's still a little sore, but it's a lot better than it was. So we're adjusting her right SI joint, and you notice I'm down here on her ischium too. And then the left SI joint and the left ischium. So we're really able to affect much more of a rotational element to the sacroiliac joints by adjusting the posterior superior iliac spine up here along with the ischium, which is the bottom part of the big ilium bone. There. In the back it's called the ischium, in the front it's called the pubic bone. There we go. And then L5 straight down here. L4 straight down. L3, you'll notice my angle starts changing into a inferior to superior angle with my arm. And then We're just going nice and easy through here this afternoon. Okay. Yeah, I'm going to put your head down just a little bit here, Lisa, if you scoot up in there just a bit. There we go.
Is that good?
Yep. Okay. There you go, better. Okay, so this is right where that scoliosis is, and that's, there we go, got good movement on that this afternoon, though.
I felt that.
That was better. So we're gonna lift her blouse up a little bit and go right below her bra strap area over there. And Chris, if you want to come over here now, I'll show you how to put these pads on here. This is a TENS unit, or trans-electrical nerve stimulation device. I'm going to preset the frequencies and everything, and also for a 30-minute continuous pulse at 150 megahertz. So, see, it has two leads on it. It's got a left lead that has a red and black pad to it, and then it has a right lead that has a red and black pad to it. And so long as you remember to put the red and black across from each other, kind of like a car battery, it's just perfect. So I'm going to put this in up here just to store that. And then we're going to start like right under where her bra strap would be. Okay. And which one do I have here? The right one first? Yeah. So we'll start with the right one, and I'm going to put the black one. Now you notice her spine's right in the center, and I'm putting that on the muscles right to the very side of the spine. Okay. And that's a black pad, so what I'm going to put directly across from that, a red one. Pad. Yep. Yeah. If you remember how to jump a car, you'd be able to put these on.
Mechanic, I know how to do that.
Yep. So then on these pads on the left-hand side lead now, we're going to do exactly the same thing, only we're going to crisscross these. So I'm going to put the black one right here, yep, there, and see that's catty corner from this black one. And then we'll put the red one directly across from that black one, but you'll notice that now this is diagonal from this one, so it's red, red, black, black, but it's red across from black always. Very good. Okay, and then Lisa, if you'll just reach up here and turn these clockwise slowly until you feel them click on. And then you'll start feeling some of the electricity slowly. And you get them turned on both to where they're even, and then turn them up very slowly, because this is a very powerful unit. We get these from Preferred Physicians out of Tampa, Florida, by the way. They're great TENS units, and they're good company. They service them well. Okay, now, is that up to your maximum level of tolerance, would you say, right now?
I can turn them up a little bit more.
Yeah, turn them up to your maximum level of tolerance. That's what we want to do at first. And then once she gets that on there and wears that at her maximum level of tolerance for 4 or 5 minutes, she'll get used to that. So she can turn them up a little bit more throughout that 30-minute session. Okay. So it's automatically set to cut off in 30 minutes. When it does, you just want to remember to reach up here and turn those off. I always close this so I don't accidentally bump it up accidentally and shock myself or the patient. So I'm going to put your bra strap right down over that. And you see, you can wear that around actually and put that on your belt or your pocket if you want to. I'm going to turn you on your back now. And I'm going to hold this while you do that so we can keep these. There we go. Yep. Now let's put this to the side here now. And see, it's got a little clippy thing right there, so you can stick that in your pocket right there if you want to, or clip it on your belt or wherever you want to. I always find it's easier to put it in my pocket. And you say these, and when I unhook it, I just put the pad right back on here and put the whole thing back in the box. So, you want to come over here, Chris? I'm going to have you do this afternoon. And we're going to have you find the soft spot, basically, under her sternum and her rib cage a little bit to the left. There you go. Yep, that's it right there. And then you're going to go down in slowly. Okay, so you're going to take a deep breath in.
Take a deep breath in.
And then exhale.
Exhale.
And then once you grab it and feel it, then you're going to pull it straight down. Superior to inferior. Yep, you want to pull it down. This is the part that actually brings it down below the diaphragm.
Yeah.
Yep, that's a good feel, by the way. That's exactly what you should feel at first. Good. Okay, let's do that 2 more times now. And you're doing a good job on that, actually.
Okay.
Yeah.
There it is.
I usually put this part of my hand on there so I
Right
can get
there.
a little bit more
More
pressure
force.
on it, and then when you get down in there, then you can drive it, kind of push it and pull it down that way. Yeah. She's pretty tender down in there because she's been dealing with this for a long time, but I bet you it's less tender this afternoon than it was this morning.
Yeah, it's a little bit. I mean, each time it gets a little better.
Right. Okay,
Am I-
one more time.
Yeah. Does it feel like I'm?
Yes,
Does it look?
baby, I can tell. I promise.
Yeah,
And
you
you should
get
be able
down
to
in
feel
there.
it too
Yeah.
because it's not hard as a rock.
Yeah, it's not as hard as it was that first day,
All
that's
right.
for sure.
Now take a deep breath. All right. Now let it out slowly.
And see, he's standing just right, kind of in a
Right.
martial arts stance where he gets a better fulcrum there and he can pull that stomach down there. It's really important for the patient to keep exhaling
Oh
while
my
you're in
God!
there.
Did
Did you feel it pop?
Yeah, I felt it.
That's
pop.
fine. That's fine. That just means it's sucking right down through the hiatus.
Okay.
There's a little opening in the diaphragm
means
called the
very
hiatus.
good.
It kind of acts like a sphincter.
Right.
So when that stomach pulls down through there, sometimes it'll pop and you'll feel that
Okay.
under
Oh,
your
you definitely
fingers.
did.
And then you also feel that big pulse right there at the
Yeah,
abdominal
I did
aorta
that.
too.
I felt that too.
And then again, what we can do with her too is do a little colon massage in a clockwise manner around there.
I feel that. Yeah.
And you
it's
can even
popping.
do that yourself too, Lisa, and that'll help with the intestinal motility and not have things backing up in there to push your food back up in there anyway.
Yeah.
But
And then
yeah,
there's
you don't
a
want to
valve
do too
over
much
here.
of that. Yeah, the ileocecal valve's kind of right down here over where the appendix would be.
Okay.
And you also rub that in a clockwise motion, but you go in on that slow too, because a lot of times that's very painful too.
Right.
Right in there, yep. You feel that?
Yeah, I feel it.
It'll kind of be a little knotted up hard spot as well.
But
So
yeah.
you want to get right in there. And a lot of times if you eat, there it is right there. You feel it?
Yes.
If you eat popcorn or nuts or peas or corn, things with husk on them, a lot of times it'll stop up this ileocecal valve. So you just kind of use this same kind of motion there. Turn it clockwise to get that moving through there. Okay, that's good. I don't want you to drop that on the side there. So let me just get down here and pull your leg.
Good job.
You can't get out here without me pulling your leg and shooting you. Yeah, that was a good job, Chris.
Thank you.
Thank you.
Did that feel okay to you, Lisa?
Yes.
Okay, good. Did you feel that all the way up? Okay, good. Now let's have you sit up and face towards your knee there. Okay, good. There we go. Okay, that's smoother. These aren't out as much. There we go. Good. Yeah, let's do your elbows and your wrists, which are pretty good right now, actually. There.
That sounds
Yep,
good.
good. And the old thing about, popping your knuckles gives you arthritis, well, that's only true if you traumatize the knuckles when you're popping them, which would be like this or that way or sideways. If you pull them straight out, that goes along with the normal plane and range of motion of the joint and will not hurt them when you pop it, because that's only a nitrogen and carbon dioxide gas that explodes in there. So Lisa, there's a lot of hopeless people out there with acid reflux and hiatal hernia that have been through the same thing that you have, years of being seen by different medical doctors and other chiropractors and being told that there's nothing that you can do for it, it's in your head and all those things, take this medication, that medication, and really it gets to be kind of a hopeless cycle, vicious cycle.
It does.
Do you feel like you have a little hope now compared to
Oh, most definitely.
before you came?
Most definitely. I mean, this is living proof.
Yeah.
Your videos are living proof.
Yeah,
I have
that's
to
why
say,
we
if
do
I
those.
may, it's thank you to Bo in Nashville, Tennessee.
Yeah.
Because of you doing
Bo,
this
you
to
started
us.
all this. Yeah.
You were the male version of me, and you just.
So, Bo, thank you for doing your video and showing everybody. And she had very, very similar issues that you had when you first came in. So, and they're both from Tennessee too.
Yes.
So Tennessee's a great state. We love Tennessee, and you're welcome to come down here to Houston, visit us anytime. So let's come over here and shoot you still. You can't get out of here without me pulling your leg and shooting you. All right, let me calm this down just a bit. There we go. Okay, let's try that same thing one more time now, please. Now look at her range of motion. It's phenomenal right now. And look at, you're right down the middle right now, see? Right down here is right down the middle. Everything's looking really good there. We're just going to pull these shoulders back still a little bit and then bring your head back and look up at the ceiling. And I'm just going to seal the deal right into your cerebellum with this. There we go. Good. That's not hurting as bad as it did either.
No, not at all.
Okay, let's take another look and see if that feels a little smoother to you. Yep. Perfect range of motion. Yes, ma'am. Okay. Well, this is how you fix the underlying cause of a hiatal hernia and help somebody who's been living without hope for the last couple of years and getting that corrected. So this is we're halfway through our sessions, and we'll be doing probably a couple more videos before they leave to go back to Tennessee. This is your Houston chiropractor, Dr. Gregory Johnson, Lisa, and Chris, coming to you from Advanced Chiropractic Relief. And can't forget Renee. She's right here videoing us all. We love y'all, and thank you for subscribing, watching, commenting, and sharing our YouTube videos. Thank you.